Good evening and welcome to the Minnesota Ovarian Cancer Alliance's Living Well meeting on managing side effects of ovarian cancer treatment and maintenance therapy. I'm Stephanie Gliniani, MOCA's Community Support Program Manager, and thank you for joining us for our live presentation and Q&A session. Tonight, we're going to discuss the common side effects many women face and find tips on how to manage them for a better quality of life. You have a handout available to you to use during the program. You could just click on the handout tab to download a copy and follow along with us. And if you do have questions for our speaker during tonight's live presentation, you can submit them through your chat box or email us at info@mnovarian.org. Now I'm so excited to welcome our guest speaker, Akia Smith. She holds a Doctor of Nursing practice degree and works as a gynecologic oncology nurse at Minnesota Oncology. She also received MOCA's Colleen Anderson Excellent in Cancer Care Awards this past November for providing outstanding care to women with ovarian cancer. Welcome, Akia, and thank you for being here with us tonight.
Thank you for that introduction, and thank you to Stephanie and MOCA for inviting me to speak about such an important topic for patients and families with ovarian cancer, as well as to those simply here for the information. Thank you to all the listeners who has taken the time to chime in today. For some of you, it will be a review or a refresher. Nonetheless, I hope that you find this information helpful.
Wonderful. Well, we are just thrilled to have you with us tonight. Take it away, Akia. Thank you.
All right, so today's Living Well topic is on managing the side effects of the treatments for ovarian cancer. However, I wanted to start with an overview. So ovarian cancer is the second most common gynecologic malignancy and the most common cause of gynecologic deaths, cancer deaths in the US. Most women present to the ER or to their doctor's office with persistent abdominal pain, bloating, or an increased waistline, bladder or bowel changes such as urinary frequency or urgency, not related to an infection, or because they continue to feel full early when eating. It can also be discovered when a patient presents for a totally different reason and then found incidentally on a scan, such as a CT scan. The most significant factors that put you at risk for ovarian cancer is having a family history of breast or ovarian cancers. Also, advancing age, infertility treatments, although this is controversial because studies are mixed, not having had children or nulliparity, endometriosis and PCOS are also theoretical risk. Some studies show that these are simply higher rates of ovarian cancer found in women who has endometriosis, although the risk is relatively low. And some studies report that multiple ovulations, such as in those going through fertility treatments, or for those who have PCOS and receiving treatments to induce their ovulations, may increase their risk. Cigarette smoking can also put you at increased risk for multiple different cancers, but specifically an increased risk for the mucinous subtype of ovarian cancer. In order to determine the extent of ovarian cancer and to help in treatment planning, it is staged either clinically or pathologically. Clinically, using imaging, biopsies, or physical exam, and pathologically with surgery. The stages range from low stage, such as stage 1 or 2, to more specifically if it does not have any high risk features, and higher stages like stage 3 or 4, which means your cancer has spread further away from your ovary. The treatment is dependent upon the type of ovarian cancer you have. There are 3 main types of ovarian cancers, and there are multiple subtypes of each of these. It also is dependent on the staging, the comorbidities, which are other diseases or conditions that you have, your overall health, as well as genetics, which plays a role mainly in maintenance therapy. The different types of treatments include surgery, chemotherapy, which is typically in those for, or in those with advanced stage disease, or in those who have lower or an early stage with high risk features. And those high risk features would include having a stage 1C or 2, having a clear cell histology, which is a specific subtype, or having a high grade tumor. Chemotherapy is also given either adjuvantly or neoadjuvant. Adjuvant means that it's after you have surgery, and neoadjuvant means that it's prior to surgery. When it's given in a neoadjuvant fashion, that means that we're trying to shrink the tumor or cancer prior to your surgery. There are also some oral therapies that are used. They're typically used during the maintenance phase of your treatment, but there are some that are also used in subsequent lines of adjuvant therapy. There are also clinical trials. These clinical trials are offered for eligible patients in specific situations and are highly encouraged to help find additional treatments from the emergence of newer drugs. The staging, or in order to determine the extent, hold on, let me click to the next screen, sorry about that. Can we go backwards? Okay, there we go. Standard treatment includes first-line therapy using platinum agents such as carboplatin or cisplatin, taxanes such as paclitaxel or docetaxel, and angiogenesis inhibitors such as bevacizumab. Some of you may know this more by its brand name or its trade name, such as Avastin or Mvasi. Receiving chemotherapy or receiving chemotherapy after your surgery with optimal debulking. Optimal debulking means that it's the removal of your primary tumor plus most of the visible disease down to 1 centimeter or less, has shown to increase your progression-free survival. This first-line treatment is often given every 3 weeks for 6 cycles. Now let's turn our attention to what we came here for today, the most common side effects of chemotherapy. These include hematologic toxicities, or the effects on your blood counts, nausea and vomiting, peripheral neuropathy, which is numbness and tingling in your fingers or toes, could be burning, could also be in your legs or your hands or your feet, constipation or diarrhea, mucositis, which are mouth sores, fatigue, myalgias and arthralgias, which are muscle aches or pains, and joint aches or pains, and hair loss. Please note that this does not mean that you will experience all of these side effects, and the severity varies from person to person. The only side effect that I can say will happen with certainty is typically the hair loss and possibly those hematologic toxicities. So let's start, I'll go through each of those separately. So the hematologic toxicities include decreased white blood cells, decreased red blood cells or hemoglobin, and decreased platelets. Your white blood cells are part of your immune system, and it helps your body to fight off infection. So if those counts are low, then your risk of infection is high. So some of those things that we advise or that we encourage you to help manage it would be to make sure you're washing your hands frequently or hand sanitizing. Make sure you're wearing your mask, especially during this pandemic. Staying away from large crowds. If family and friends are ill, they should stay away. If you're going out, if you're going to the grocery store, make sure you're not putting your hands in your face or your mouth. Make sure you're wiping those carts down. Your red blood cells and your hemoglobin are what carries oxygen through your body. And so when those counts are decreased, then you often feel a little bit more tired or fatigued. You may have some shortness of breath with activity or with exertion. You may feel a little dizzy or lightheaded, especially if it's lower than normal. For that, we encourage you to continue with your routine activities. Try and stay as active as you can. walking and light activities throughout the day, but taking your rest and naps as needed. Make sure you're eating a well-balanced meal, especially high proteins, good calories. Drink plenty of fluids, and recommending 6 to 8 glasses a day. Platelets are what helps our blood to clot. So when those counts are low, then you're at an increased risk for bleeding. So make sure that you're careful around the home or outside. Try not to bump yourself. That may cause easy bruising when those counts are low. Use caution with sharp objects. And when those counts are critically low, and we will tell you that, we do recommend that you are avoiding aspirin type products or NSAID type products such as Advil or ibuprofen. Nausea vomiting is another side effect, and this is actually one of the ones that most patients are concerned about. You know, are you going to feel ill, or how sick will you be? In my experience with my patient population, I would say it's probably the least common. It's a common one, but it's probably the least common one out of the ones that they are having. And I think that's because of the anti-nausea plan that we put in place. There are some pre-medications that are added in, or they're given before your chemotherapy to help reduce that risk of chemo-induced nausea vomiting. There are also some scheduled medications that we may prescribe, such as dexamethasone, to help reduce that risk. There are also PRN medications, such as compazine or Zofran. And then we often recommend that you're eating small meals frequently, so snacking throughout the day. Try not to eat too large or too heavy of a meal. Also avoiding fried foods, greasy foods, spicy foods, sometimes dairy. Stay hydrated. Make sure you're drinking plenty of fluids. Avoid offensive or strong odors. And then some of the tips for foods besides bland foods would be toast or crackers, soup, ginger ale, sometimes even peppermint, sometimes aromatherapy sticks may all be helpful as well. Peripheral neuropathy, again, that's that numbness and tingling that you may feel in your fingers or your toes. Usually one may start to feel this, and at first it may be something that's manageable, so it's there, but it may be a little annoying. But if you do get that, we do want you to avoid extreme temperatures. Sometimes your hands or feet get really cold fast, or sometimes you may not even realize the intensity of heat, like using things over a stove. So you want to try and avoid that and protecting yourself. Sometimes when neuropathy is affecting your feet, you may feel a little unsteady as well. So make sure you're careful on your stairs, using your handrails, clearing your walkways from trip hazards. Some of the interventions that we use to manage peripheral neuropathy would be prescription medications that can be used. Also over-the-counter meds that we may recommend. Now these are mixed in studies. Some patients say that they work, some don't. Those would be things such as vitamin B6 or omega-3 fish oil. There's also some non-medicinal interventions such as acupuncture or even physical therapy to help increase your strength. And then, of course, we're always going to consider dose adjustments or reducing the dose of your chemotherapy. Constipation and diarrhea is another one. Again, in my experience with my patient population, I would say constipation is probably a little bit more common than diarrhea. But with constipation, you want to make sure you're increasing your fluid intake, so drinking plenty of water to keep your bowels hydrated, which helps to keep your stools soft and easier to eliminate. Prune juice or prunes are helpful. Fruit and cooked veggies. Now, cooked veggies are usually pretty good, or are a little better than raw veggies because they absorb that fiber content better or easier to digest. Bran or whole wheat breads are also good because of that high fiber content. A brisk walk or exercise can be helpful. And of course, there are some over-the-counter medications that we typically recommend that you have on hand, which are laxatives or stool softeners such as Miralax or Senna. And note that there are many different over-the-counter laxatives. Whatever works for you is okay. These are simply suggestions. Diarrhea is the other bowel effects. So with that, I would recommend doing more of a bland diet or a brat food diet. So a brat food diet, it's an acronym. It stands for bananas, rice, applesauce, or toast. Many of you probably have heard of that. Make sure you're increasing your fluid intake because you're losing a lot of fluids with diarrhea. Clear liquids are good. Replenishing those electrolytes because you do lose those in the stool as well. So things such as Propel or Gatorade. There's also antidiarrheal agents over the counter such as Imodium. And that's also called loperamide. Mucositis, again, that is the mouth sores that you can experience. The mouth sores are common to like a canker sore that you may have in your mouth, and sometimes it's not even an actual sore. Sometimes you may just have mouth tenderness or your gums may be a little tender. So if you're experiencing that, then I often recommend that you use a baking soda or salt rinse. It's usually a 1/4 teaspoon of baking soda with a 1/4 teaspoon of salt. You mix that with a cup of warm water, and you gargle with it or rinse with it a few times a day, and that's usually helpful. Avoid mouthwash with alcohol. Sometimes you get small cuts or tears in your mouth or in your mucous membranes, and you may not realize it, and so that alcohol would not feel good. Eat soft foods. Avoid those spicy, acidic, salty, or rough foods. Keep your lips well moisturized. Use a soft bristle toothbrush. And then finally, the magic mouthwash. Now, that's something that we often prescribe if all else fails, or something to try for those experience the mouth sores. So it's a combination rinse. It's usually like a Benadryl, a viscous lidocaine, and a Maalox. And that can be gargled and spit out, or it can be swallowed. It just depends on the extent of the mouth sores. Fatigue is a big one, and you may have that before, during, or after chemotherapy, but I can't stress enough to make sure that you're staying physically active or engaging in physical exercise throughout the day or multiple times a week. Just staying active, avoid laying or sitting around all day, pacing yourself to conserve your energy, plan out your activities, and then take a break in between. Sometimes lighter music therapy is helpful. Meditation is helpful. Having a good sleep hygiene is also very important. Take your rest and your nap breaks as needed, as I talked about before. Make sure you're eating a well-balanced meal. Again, high proteins, again, staying well hydrated, and most certainly managing your stress. Myalgias and arthralgias, again, muscle and joint pain. For that, I usually find that most patients who experience it can have pre-existing muscle or joint pains due to arthritis or due to fibromyalgia. And sometimes you may get it if you don't. But to manage that, we recommend that you take some pain medications that can be Tylenol and or ibuprofen amongst others. There's pain creams and patches over the counter that can be used, such as Salon Pause, there's BioFreeze, there's Asper-Cream, there's tons of different ones. A gentle massage is helpful. Soaking in a warm tub or a warm shower is nice, and using heat or ice. And then there's hair loss, or also called alopecia. Now, this does typically start right after your first or second cycle. You may start to notice more hair shedding, or if you run your hands through your hair, you may see some clumps of hair coming out. Make sure that you're protecting your scalp when you're going outside in the elements. Whether you're using a wig, a hat, or a turban, or a scarf is totally up to you. Make sure you're avoiding harsh products or harsh chemicals, especially permanents and dyes. Use a soft hairbrush because sometimes your scalp does become a little bit more tender. Use gentle shampoos such as baby shampoo. Again, just a suggestion, if you have a good gentle shampoo, such as ones without sulfates, again, or harsh chemicals, then that would be nice. And then there is a specific shampoo, it's called Nioxin. Again, just a suggestion, but often recommended if you have kind of that dry, itchy scalp, or if you have some discomfort in your scalp. Nioxin is usually found in most professional hair salons, or you can get it on Amazon. So then I'm going to go back to bevacizumab because this one has some different side effects than the ones that I listed. But bevacizumab is a targeted therapy and is often given with first-line chemotherapy to help enhance the effect. It does this by starving the cancer cells of its blood supply to slow or suppress its growth. It also increases your progression-free survival. Not only is it given with chemotherapy, it's also given as a maintenance treatment. And when it's given as maintenance, it's usually given for an additional year or for 16 additional cycles typically. It's usually well tolerated and it does not affect your blood count, so you may not have those same side effects as with chemotherapy. But some of the side effects that we do monitor would be increases to your blood pressure. So if you already have hypertension and you're on blood pressure medications, sometimes those medications may need to be adjusted. We do monitor for proteinuria, which is too much protein in the urine. So oftentimes when that happens, we're worried about kidney damage or kidney disease, impaired wound healing. So any surgical or invasive procedures that you have should not be performed no less than 28 days after receiving the bevacizumab, and then no less than 28 days to restart it after the procedure or until you're fully healed. It can also cause a risk of bleeding or blood clots and a very small risk of GI perforation or toxicity. So if you have bowel involvement with your cancer, it doesn't mean that you may not be eligible to get it, but some people may not be a good candidate for it. So make sure you're always having that conversation with your oncologist to discuss the risk and benefits of this treatment. Then there are oral medications for maintenance. Again, let me just explain the maintenance therapy because I should have explained it a little bit earlier, but maintenance therapy is the phase of your treatment after completion of chemotherapy. The goal of the maintenance treatment is to further enhance your progression-free survival and to keep your cancer at bay or slow growing. PARP inhibitors, or poly-ADP ribose polymerase, are a type of targeted therapy that are FDA approved for use in first-line therapy for maintenance treatment in ovarian cancer. Some examples are olaparib or Lynparza, niraparib or Zejula, and rucaparib or Rubraca. They work by slowing or preventing cancer progression by inhibiting the repair of the damaged DNA of the cancer cell. PARP inhibitors improve the progression-free survival in patients with the BRCA gene or breast cancer gene mutation or other proteins that are BRCA-like. These pills are taken daily for 2 to 3 years, dependent on which one you are given, or until progression or significant toxicity. The side effects of PARP inhibitors are pretty similar to those that I discussed earlier with chemotherapy, and so I would recommend those same tips for management. However, it's good to note that the side effects are most common in the first couple of months of starting these oral pills and are typically more well managed than with chemo. So some of these common side effects would include fatigue, nausea, vomiting, hematologic toxicities, loss of appetite, muscle or joint pain, and constipation or diarrhea. Often side effects become severe or intolerable, or they're not well managed, then we may hold or stop your medication for a specified amount of time or until you are able to recover. And we would also then consider reducing your dose. These are some, these are some of the sources that I use in preparation for my visits on a daily basis to provide some more up-to-date information to my patients. Some of these sources have some really good patient-friendly information or guidance in layman terms to help also guide you. So you may want to go to some of those websites and find that as well. This concludes my presentation. I hope you found this information to be helpful along your journey, and I hope that you can use this in order to have a good quality of life while going through your treatment.
Thank you, Akia, so much. We greatly appreciate you being with us tonight and sharing your expertise. I know that I'm thankful, and I know all those in the audience, I'm sure, are grateful that you are here with us. So what we will do is jump right into questions. And so for those who have questions, you can put them in either the chat box or you can email them to info@mnovarian.org. So as we get going with questions, feel free to send those in and we will address them. So our first question of the evening, and I know you touched on this a little bit about fatigue, but do you have any extra tips or thoughts for ongoing fatigue and ongoing low blood counts? It sounds like this person just is having cannot keep the blood counts up and is just having really ongoing fatigue.
Ongoing fatigue is typically common. There are or I shouldn't say quite a few, but there are a few side effects of chemotherapy that you can experience even after the completion of chemotherapy. How long it lasts is a good question. We just don't know. Sometimes it can go months, sometimes even years. But the same management tips apply. Try and keep yourself active, push yourself. I know it can be hard sometimes, but even if you're doing some chair exercises, even if you're doing something 5-10 minutes a day, but consistency is key. Keep yourself active, physically fit. You can certainly continue working, but remember to take your breaks and your naps. Don't overdo it either. Sometimes when there's those prolonged fatigue and one is just having a hard time getting things back to a normal rhythm for themselves, we may even recommend that you're going to physical therapy, or there's other programs that are out that be helpful, like cancer rehabilitation and things like that. As far as the blood counts, I don't, after you complete your chemotherapy, usually within the next month or so, those blood counts are coming back up to normal. If it isn't, we do start to be concerned about other conditions such as MDS or myelodysplastic syndrome, and oftentimes may refer you to a hematologist who are a little bit more well versed than I am on managing those blood counts, just to make sure that there's no other indication as to why they're not coming back to normal.
Okay, perfect. As you were sharing that, there was another question as to how is low blood counts treated during treatment. So you kind of touched on that too. And then what do we need to be aware of when our neutrophils or neutropenia, which is our blood counts when they're low. So I think you pretty much covered those. But is there anything else to be aware of when our blood counts are low?
Yeah, so with neutropenia, so there's different ones. You can have low white blood cells, low red blood cells. So neutropenia is kind of a low white blood cell. And again, that's one of the components that increases your risk of infection. And so we often want you to monitor for fever, because if you do have a fever with neutropenia, so your counts are low, then we call that a neutropenic fever, and you may need to be treated with a prescription antibiotic, or sometimes you may need to be hospitalized for IV hydration or IV fluids. So watch for those basically viral type symptoms. You can treat your symptoms over the counter. So if you're having, a cough, or you're sneezing or coughing or runny nose, go ahead and treat yourself over the counter. Those things are not contraindicated unless there's something specific that you're allergic to or that your doctor told you to avoid. But if you do have a fever and it's greater than 100.4, then we do want you to give us a call. We want to hear from you, because then we are worried about an infection.
Okay. That was such a great explanation of that. Thank you so much. So our next question is, what is the best way to be sure my healthcare team helps me address and manage my side effects? I think that's such a great question.
That is a really good question. There are so many ways. So first off, when you do come for cancer treatment, every time you come for day one of your cycles, and it's typically day one, it certainly can be more often if needed, you are meeting with a healthcare provider, typically one such as myself, during your treatment, and we're meeting with you so that we can discuss how you're doing, see how you're feeling, manage your symptoms. There's also some other interventions that I know my clinic specifically engage in. It's called chemo tracker. So you essentially get a text message on your phone. So you sign up for it and it'll ask you how you're feeling, what are your symptoms, and give you some tips. And depending on those symptoms that you choose or the severity, then that will warrant a phone call or we'll call you. So one of the nurses will give you a call and ask how you're doing or how they can further assist in managing those symptoms. Or you can say, I don't need a phone call. And then more importantly, make sure you're being an advocate for yourself too. There's no reason that you can't call the office if you have any questions or concerns or any symptoms. Our offices, you know, are normal business hours, 8 to 5, but there's always an on-call provider. So there's an answering service that answers, and if you have an urgent need, then that will be given to that on-call provider who will be calling you right back. And that's evenings, weekends, holidays, overnight. So we always try and make ourselves available to you.
That is great. And I always share with people to bring a notebook with them to their appointment. Write down your side effects, track them, and, make sure you're bringing them up with your provider. And if you can have someone at your appointment or have someone call in, a loved one, make sure that someone else is listening too. So I think it's great that about being your own advocate and sharing when symptoms are coming up. So I know that
Mhm.
that's helpful. So thank you.
Yeah, writing those symptoms down and journaling is really important. I often recommend my patients to do that. We provide a journal and a calendar with the big boxes, or you use whatever type of journaling material that you have, even if it's just a notebook, because doing that also helps you to be proactive with your symptoms. So some of those symptoms repeat themselves from cycle to cycle. And so if you know that, oh, I started having constipation, let's say, day 3 of my treatment. So we'll say, get started on that senna or so the night of chemo or that day 2 so that you can get on top of things. So that'll help you with being more proactive as well.
Absolutely. Yes. Thank you so much for that. So next question, which I think is just a great one, and it sounds like the steroids sometimes that you're given, during chemotherapy might cause insomnia. Do you have any tips to combat insomnia? This sounds like either falling asleep, staying asleep, or waking up in the middle of the night. Anything to help with, sleep.
Yeah, insomnia is a big one too. I know your minds may be just cluttered with all types of thoughts and what's going on in your situation and how you're going to get through your day or your life or what have you, and just cause that insomnia. The steroids can also cause that. I kind of giggle about it because some patients actually like the steroids because it kind of helps them to be up and moving around and going for that day 1 or 2 after chemo. And then once that kind of wears off, they're like, I need more steroids. But yeah, the other thing is because some of those scheduled medications like that steroid, we want you to take prior to. So it can be taken a number of different ways, but one of the ways is taking it 6 hours prior to your treatment, which involves getting up in the middle of the night. But as far as insomnia, trying to plan out a good sleep hygiene, try not to eat too late, try and have a set bedtime and wake up time. Try to avoid caffeinated drinks or caffeine right before. Try and take away all stimulus, the phones and the TVs and things like that. Try and start to relax your mind. Sometimes reading a good book is helpful. Sometimes drinking some warm milk, meditation. There's different apps that you can find on your phone with some good breathing exercises. That's often really helpful. Sometimes taking your soaking in a warm tub or getting a good massage right before is really relaxing. So there's a number of things in that way.
That's great. That's super helpful. Um, so our next question is, do you have any helpful tricks for blisters on the hands from a certain chemotherapy? It sounds like cracking, sores, rashes, which we know is another side effect too. So any tricks for that?
Yeah, it can be. That specific treatment that typically can cause that is you're likely talking about doxil or liposomal doxil. It can cause some um, hand-foot syndrome, we may cause it. Chemotherapy can be drying to the skin also. So I always recommend that you're keeping your skin really well moisturized with a good cream moisturizer. Lotions I usually try and stay away from because they're a little bit thinner. Some of examples of those moisturizers would be Cetaphil, CeraVe, Aquaphor, Utter Cream. Those are some of the ones that are usually a little thicker. Aveeno or Eucerin, those are some other ones, and really well moisturizing your body. Your hands, you may need to do hands or feet multiple times a day because you're constantly washing them. Um, if you do start to get those blisters or there's cracks, sometimes there's some urea cream that we may prescribe. And then you definitely want to make sure that you're reaching out and letting your healthcare team know that, because then they may need to hold that chemotherapy to allow that to get better or to heal.
Sure. That makes sense. Thank you. That's really helpful, Kia. So the next question is about blood pressure. With PARP inhibitors, it can be a side effect of high blood pressure. Without being on a blood pressure medication, is there anything else that you can do to manage blood pressure, or is it just changing dosage or getting on a blood pressure medication to be able to handle that PARP inhibitor?
So I'm going to say PARP inhibitors I've not heard really to cause increases in your blood pressure. That's more likely with the bevacizumab or the Avastin. But if you're not on a blood pressure medication, then typically watching what you're eating, some salts would be causing, higher blood pressure, stress management. Sometimes anxiety can increase your blood pressure. Um, Exercise is also good, eating a well-balanced diet, increasing your water intake. So basically it would be some lifestyle modifications, diet, exercise type of things that will help. But you definitely also want to be in contact with your primary care physician to help with managing that as well, because oncologists, we typically don't manage it. We'll definitely monitor it. Most of us don't. There are some, I should say, that are not gynecologic that may manage it, but most often it's your primary doctor.
Okay, perfect. This next question kind of leads off a little bit of more about being physically active. Do you have any ideas for staying active to combat fatigue during the pandemic when you may not feel comfortable getting out? I know that's a hard one. We're all probably, it's the winter, we're in Minnesota, but is there any tips or anything?
Good question. If you have, I'm just trying to think now, you just kind of have to get creative in your house. There are lots of free YouTube videos that you can use for exercise and do right in the comforts of your own home without having to go out. Going up and down stairs safely, and as long as you don't have any limitations for that. Um, Chair exercises, walking to your mailbox, even if you walk up and down your block. I know it's cold out, but it's another option for those who may not mind it. Of course, be careful of the ice. If you live in an apartment building, I know some patients will walk up and down the halls. That may be helpful. Doing things to stimulate your mind, like puzzles, Sudoku puzzles. Those are just I'm sure there's many more out there, but it's definitely just being creative and finding things to do within your own home.
Absolutely. Yeah, I think, and we all need to be creative during this time too, especially living in this climate of not being able to get out as much, in the warmer weather. So thank you for that. Another question, I've read that using ice packs on hands and feet during chemo can reduce chance of neuropathy. Do you have an opinion on the use of ice packs proactively? It's a good one.
I say go for it. I do have some patients that use ice packs. I had a patient who sat in chemo. She brought her ice packs or her baggies with ice and taped them around her feet, taped them around both hands. And she sat there with them with her chemo and changed her bags out. And she swore by it. And she never really complained of any neuropathy. Very, very mild. So I definitely do give that as an option to say, hey, you can try it. It won't hurt to do that. I don't know if there's any scientific evidence to show that it helped, but try it. I have a lot of patients that says that it works for them.
Absolutely, yes. And we know there are survivors as well that we connect with the same thing. So I agree. Why not try it? Yeah. Perfect. Another question is change in smell or taste. Do you have any tips for, I know that there can be a metallic taste while you're eating foods, and smell, anything to help with that?
Yeah, those taste alterations are pretty typical. People may have bitter taste, something tastes too sweet, something tastes too metallic-y. I don't have a lot of great tips for it. You may want to find a food. Some foods, actually, I know sometimes if you have nausea, you want to stay away from strong or offensive odors. But sometimes when you have taste alterations, as long as it's not affecting you nausea or vomiting wise, then go for foods that do have more of a stronger odor that you may be able to smell or taste a little bit more. That's really the biggest thing that I can think of off the top of my mind. I'm sorry, I don't have
Yeah, that
anything.
can be a tricky one.
Yeah.
Can you give us any advice on mental health support? So side effect, I guess just treatment and therapy, going through ovarian cancer treatment. Do you have any advice on taking care of ourselves mentally?
Yeah, that's huge. And I definitely want and hope that and encourage you all to take care of yourselves mentally. We do often monitor for that also and encourage and offer up support for those who need it. There are social workers that your clinic may have in place for you. We may recommend psychological evaluation, psychiatric evaluation, and it doesn't always have to be something dealing with medication, but definitely just taking care of yourself and your well-being. Sometimes there's just talk therapy or different forms of therapy that may be helpful. There are also support groups out there. There's programs that you can join with people who are in your same or similar situation. I know, you have your family and your friends as your good support as well, and sometimes you just need something outside of that. So those support groups are very helpful during that time. But definitely speak up. Don't think that you're wasting time or that you sound crazy or anything like that. We want to hear from you. We want to be there to support you and to talk you through things and get you the help that you need.
Absolutely. Do you guys have therapists, or how do you suggest finding someone working with a cancer patient? Do you have any suggestions on finding someone? Do you have referrals through clinics?
Yeah, we do have therapists that we refer to. In our clinic, we often get the social worker involved, who is also a licensed therapist as well. They do some short-term therapy, and then if there's long-term therapy that is needed, then I know Cashman group is one that may be helpful. There's also, I think Virginia Piper may be helpful. Um, those are a couple of ones that I can think of off the top of my head. Your primary doctor may also have some relationships with the mental health therapist or so that may be beneficial for you. Regardless of what it is, our schedulers are also awesome. Some of our MDs and our providers do have relationships with other therapists, and we always want to make sure that we get you to the right people or to help you. We don't put you out there and stick you on your own, but we do provide some resources and referrals to help out.
That's great. And I think it goes back to of advocating for ourselves. So if you are looking for that extra support, make sure to advocate and ask, reach out to your healthcare provider. Obviously, we have a lot of support at, MOCA too. So let people know that you're looking for extra support. So thank you for that. Our next question, what can we do to manage hot flashes?
Whoa, hot flashes. Hot flashes is a big topic. That can be another hour
Yeah, it can
long
be another meeting.
topic. Yeah. Hot flashes are pretty common in women, especially when you're getting put into surgical menopause. So if you hadn't gone through menopause before and you're getting your ovaries out, then you're put into surgical menopause. And then postmenopausal women are more at increased risk for ovarian cancer. So a lot of them were postmenopausal and may have gone through those menopausal symptoms, but as soon as they get that surgery and those ovaries are removed, sometimes it puts them back into having those symptoms. First and foremost, I talk about lifestyle modifications or lifestyle changes. So things simply as wearing light layers or dressing in light layers so that you can peel off as needed, using a fan or ceiling fan or opening your window, trying to avoid caffeinated drinks or hot beverages, right before bedtime. If that doesn't work, or if your hot flashes are more severe, or if you're unable to manage it that way, let's say it's happening multiple times a day, multiple times at night, it's causing insomnia or waking you up drenching wet or so, then there are things that we can do medication wise. Some ovarian cancers can still have some hormone therapy. Of course, that would be a discussion that we will have related to your own risk. And then if hormone therapy is not an indication for you or is contraindicated for you, then there are non-hormonal therapies that can be used too.
Wonderful. Thank you, Akia. That was really helpful. I have one more question, unless we keep having more come in, but I have heard that palliative care can help manage side effects. How do I go about seeing someone, and is that true? Palliative care can help?
It does, and thank you for
Okay.
bringing that up because
Yeah.
I should have mentioned that as well. We do have an awesome palliative care team and provider at our office, and I would assume other offices as well. But during my initial chemo teaches, I often start to talk about and introduce our patients to what palliative care is. So basically, there's a misconception about it, and I know a lot of patients are a little hesitant about it because they feel like it may be end of life, but it truly isn't. These providers are there to help. They're an extension of us. They're additional resource, but they're there to help manage those symptoms or chronic symptoms that you may have related to your cancer, and often can provide and manage more longer term treatments or therapies and have more, a vast information too about managing symptoms. And so along with us and seeing us during your regular chemo visits, then we also would say see palliative care. And how we do it is we simply put in a referral and get you an appointment scheduled to have an initial visit. That initial visit, you'll have a consultation. They'll go through their thing with you and talk about potential side effects and how you're doing. They often see you, after your cycles to see how things are going with you, or more often as needed. Sometimes it may be 1 or 2 visits, and sometimes it can be extended visits, and it can be during or after treatment as well. So again, advocate, talk about that palliative care if it hasn't been brought up, and a referral can be put in for you.
Perfect. We did have another one come in, and this isn't necessarily a side effect question, but you might be able to give more of a generic, it's kind of individualized, but a generic answer to this. But you mentioned that Lynparza is used for 2 to 3 years, but if you have not progressed after 3 years, would the doctor keep you on Lynparza longer? And that might be a question for your healthcare team, but
Yeah.
feel free to answer that how you feel.
Yeah, Lynparza is actually used up to 2 years. The only one, just to clarify, that's used for up to 3 years is niraparib. But the Lynparza is used up to 2 years, and as you get to that 2 years, then you would have a visit with your provider, and you're having visits all along in surveillance. Then you would go off of of the Lynparza. That's how long it had been studied for and evidence. It hadn't been studied longer, and so we don't go longer than that 2 years. After that, you would just go into surveillance. So we would be seeing you in clinic every 3 months, for the first 2 years of your surveillance, and then it goes to 6-month visits, and it's different for everybody. You talk to your provider about your specific surveillance plan, but yeah, it only goes up to 2 years for Lynparza. And of course, if you're having some toxicities or you're not tolerating it well, then you go off of it sooner.
Perfect. That was really helpful. Thank you. I think that was an amazing, for one, an amazing Q&A, and you were just amazing. So
Thank you.
I think we will end just a couple minutes early, but that was some great questions, and we just thank you so much for your time and for your dedication and your compassion. And yeah, I just want to thank you so much for being here with us tonight.
Thank you, Stephanie, and thank you all for joining and attending. I hope that this has been a good refresher or help for you, or good information. I appreciate you all.
Well, thank you, Akia Smith of
And
Minnesota
thank you to
Oncology.
MOCA as well, sorry.
No, that's okay. Yes. Thank you. And I want to thank the audience too before we go. This was our first Living Well meeting of 2022, which is exciting. I do have just a couple notes before we wrap up the session. And we did talk a little bit about mental health during our Q&A. And for those who are new to MOCA and want to learn more about our support programs and resources for survivors, loved ones, and caregivers, we do have bi-monthly support groups. We have a MOCA mentor program. We have MOCA Cares Kits, and you can find that all on our website at mnovarian.org, or you can send us an email at info@mnovarian.org, and we'll get you connected. If you did miss a portion of the session and want to watch it again, we will be posting the recording on our website too. And one final note, after you close out the session, you'll receive a survey pop up on your screen. If you could just take a moment to answer a brief couple questions about your experience tonight. We read through all the survey questions and the comments, so would really love to hear from you. So thank you, everyone, and have a wonderful evening.